Good afternoon, everybody. My name is Dr. Asna Naqvi. I'm from Lucknow, and I am a part of the course C2 course, 105th batch. I'm going to talk about ovarian stimulation for a patient of IUI. So IUI can be done in patients in a natural cycle as well, where we do not give any medicine at all, and after 24 hours after the LH surge, we do the IUI. But most of the time, practically, we go for ovarian stimulation and the ovarian trigger, ovulation trigger when we are doing the IUI. So in case of ovarian stimulation, the drug of choice is letrozole. Reason being that it leads to monofollicular growth, and we avoid multiple pregnancies, we avoid cases of OHSS. The dose that is recommended by the FDA is 2.5 milligram, but in case the patient is not responding to it, then we can go up to 5 milligram of letrozole. Generally, it is given from day 2 to day 5 of the cycle. Then the ovulation stimulation can be done alone with letrozole only, or the other drug that we can go for is clomiphene citrate, 50 milligram or 100 milligram, again day 2 to day 5 of cycle. Now ovarian stimulation can either be done only by these, or we can add the gonadotropins or the HMG also. In case we are giving the gonadotropins, then they are given for 3 days, from day 6 to day 8 of the cycle, and then from day 9 of the cycle we start the follicular monitoring through the transvaginal scan. When our dominant follicle reaches the size of around 20 millimeter, that is the ideal time when we give the ovulation trigger through the injection of HCG. Normally we use 5000 international units. Then IUI is done, timed in such a way that we are able to do IUI 24 to 48 hours after the ovulation trigger. Normally the practice is to do 36 hours after the ovulation trigger.
40 hours.
Sorry?
24 to 40 hours.
Okay. So normally we do after 36 hours of ovulation trigger. After we have done IUI, we advise the patients for sexual intercourse for the next 3 days. In case during our process of the ovulation stimulation we have used the gonadotropins, then it is advisable to give the luteal phase support as well. That can be given in the form of micronized progesterone vaginally, 400 microgram, or we can give dydrogesterone 10 milligram TDS starting 3 days after the IUI. Any questions?
Thank you.
Thank you.